Hello, everyone, and welcome to this Institute for Government webinar looking at the second module report of the UK's COVID inquiry. My name's Hannah White, and I'm the CEO of the Institute for Government, and it's fantastic to have you all joining us here today. So, Module 2, all about government decision-making and political governance of the pandemic. Yesterday afternoon, the COVID inquiry released its second report, and this is only the second of 10 planned modules. This one was looking at activities within Whitehall during the initial phase of the pandemic, including decisions made by the Prime Minister, Chancellor, advisors, and senior civil servants, as well as how expert advice was received and applied. And the module contains 3 sub-modules that consider decision-making in Scotland, Wales, and Northern Ireland, alongside the relationship between the devolved nations and the centre. Now, you, like us, may feel that this all feels quite a long time ago, but to jog your memory, the period of these early decisions that were made during the pandemic included things like going ahead with the Cheltenham races, the initial lockdown at the end of March 2020, through to Eat Out, Help Out, local lockdowns, and NHS COVID passes. This gives you a bit of a flashback there, I'm sure. So the evidence sessions featured testimony from key government figures, revealing what many of us had already feared and seen evidence of: an absence of effective leadership from the centre, major issues with incorporating evidence and expert advice into policy decisions, a toxic culture at the centre, and frequent use of WhatsApp messages for critical decisions. Preliminary hearings for Module 2 started in October 2022 and concluded with a final public hearing in May 2024. So it's been taking quite some time to get done. And we're going to today look at the report and discuss what we should take from it. And I'm delighted to be joined by a fantastic team of top Institute for Government colleagues who are going to be discussing this with me. These are very IfG questions, so lots for us to chew over and reflect on. And we'd be really delighted if you would send in your questions via Slido so that we have some thoughts that we want to discuss amongst ourselves, but we're really keen to answer questions that you may have and want to put to us too. So who is on our panel today? We have Tim Durrant, who's our Programme Director for the IfG's Ministers work, Akash Paun, who leads our devolution work, Alex Thomas, who leads our civil service work, and Stuart Hoddinott, who's the Associate Director in the Public Services team. So we've got all bases covered. And I think we will kick off, Alex, with you. Looking at this very long report, 800 odd pages, which I know you have digested overnight, at least to some degree. There's a very detailed account of what happened during this key phase in the pandemic. And the report sets out some lessons for government. But I guess the key question that we've all been asking over the last 12 hours is, what have we learned that's new?
Yeah, and don't ask me what's on page 649 of the report, but I have not read every word, but tried to digest it. No, I think is the basic answer. There are some specific new things that have come out, but in terms of the overall government response to the pandemic, the sorts of lessons that needed to have been learnt and areas where the government could have done better, I'm not sure there are any big ticket new points. It's clear, and this goes to some of what you were saying in the introduction, that particularly through that first year of 2020, the strategy and objectives of the government were often unclear and contradictory. It's clear it took the system longer than it should have done to gear up for both that initial phase of the pandemic and then the subsequent responses over the course, again, of particularly 2020 and early 2021. I was struck, a lot of the media focus has been on March 2020. I was even more struck actually by the fact that Baroness Hallett put in the report that it was, quotes, inexcusable, some of the confusion that persisted throughout 2020 when the government should have been was learning more about the virus and should have been more coherent in its response. You pointed to the problems with culture, particularly in Downing Street and parts of the Cabinet Office. I think that was well known, but it's important to record that. Akash can talk, I'm sure, to some of the questions about intergovernmental relationships and devolution. I thought it was striking that the report gave thorough coverage to Scotland, Wales, and Northern Ireland, as well as the UK government. Talks about the use of data. Talks about there's a very detailed chronology of much of the pandemic, which I think will be useful for the civil service and future governments. But was there some huge new revelation? No. Are the recommendations telling us things that we didn't already think a good government should actually pursue? Also, no. Was it a valuable exercise? Yes. We might come on to some of this. Was it cost effective and cost benefit? Perhaps more questionable.
Yeah, and the first question that's come through on the slider gets at exactly how I was going to follow up on that question to you, Alex, which is, what is this really, looking at this report and its value and how long it's taken to get here, and how, I think we think £250 million spent so far by the inquiry. Is a judge-led public inquiry a good model for learning timely lessons about how government works?
If you include your word timely there, then I'd say again, more confidently, no. It tends not to. I mean, they can be relatively quick, but it's not the model where you're going to extract the most sort of valuable lessons the most quickly, and that's in part because if it's judge-led, that means there's a sort of heavily legal element to the process. There are rules around evidence. There are rules around what gets disclosed. It also, and I, certainly felt this even as an expert witness as part of module 2, before you even get to people who were kind of being scrutinised, it puts witnesses in an antagonistic and defensive position, sometimes with good reason. And there's an accountability question there, and there's there are important points around holding decision makers to account. But the process can quite quickly take over. So I think judge-led inquiries are sort of good for evidence gathering and requirements around the rules of evidence. They're good for elements of accountability. I'm not convinced they're the best way to get to really quick lessons about how government works. And that sort of loops back around a bit to my point that this is a valuable exercise, but most of those conclusions, we put in reports from the IfG, the media has aired, have been kind of quite widely discussed, both shortly after events happened and over the course of and aftermath of the pandemic.
Okay, Tim, let's come to you next. We recently published a report on the role of ministers in a crisis, how ministers can lead effectively. What do you make, given you've done that thinking and that research, what do you make of the inquiry's recommendations on political leadership in a crisis?
Well, I have to say it was quite a sort of pat on the back for the IfG, I think, in that some of the recommendations or points that the inquiry made tallied very closely with our work. And some of it is kind of, in a way, it's stating the obvious, but sometimes that's important to do, right? So what do ministers need to do in a crisis? They need to set clear objectives. And I think that's one part of the problems that the inquiry identifies, that the objectives that ministers were trying to achieve were not clear throughout the pandemic and also were changing. Sometimes it was about protecting health, reducing transmission. Sometimes it's about protecting the economy. Objectives do need to change, but being clear about what they are and communicating them clearly is important. A second point that the inquiry made that we also talked about is, having chosen those objectives, make the decisions that are necessary in order to achieve them and make them in a timely manner. And this is one of the points that really came strongly through in the report, right? Is the sort of the uncertainty, which was completely understandable in January, February, the first 2 weeks of March 2020, meant that ministers didn't take a decision. But in this sort of situation, not taking a decision is still a decision. So that, there were decisions about, there's a lot of discussion about, should the government have locked down earlier, but also should it have been introducing more restrictions? You mentioned some of the big sporting events that were happening in the first few months of the year. Those kinds of things, by sort of carrying on with business as usual, that is in fact a decision. That's not a sort of a neutral stance. And so I think that point about ministers realizing that kind of the do nothing option is still a choice is really important. Two other things I thought worth flagging. One is about communication, and that's communication sort of within the team. You know, your close advisors, your close civil servants, but then also communication with everyone else who is affected. And obviously, in such a big, all-encompassing crisis, that's the entire country. The comms got better through the pandemic, but it was confused, and I'm sure we'll talk about in the bit about relations between the different governments in the UK, the sort of which bits of regulations applied to which bits of the UK. The comms on that was not always clear. And then the fourth one I want to mention is, and Alex has touched on it already, but culture, and this obviously comes down to leadership. And one of the points we made in our work on crisis is, this is true in normal times, but it's even more so, ministerial leadership sets the tone and sets the culture of government. And in a crisis, when people are stressed, when, as in the pandemic, you know, lives are on the line, it's inevitably high pressure, high stakes. It's very difficult for people. What you need from a leader is someone who recognizes that, someone who supports their team, someone who encourages their team to look after themselves and after each other. And that just seemed to be completely lacking. You know, this sort of very toxic environment in Number 10, that obviously the stuff about Dominic Cummings in particular, but it wasn't just him. There's a line from Boris Johnson saying, you know, chaos is good because it means everyone knows that I'm in charge. That is not a sort of conducive setup to making the difficult choices that were needed in this situation.
And a lot of the headlines we've seen today have been focusing on some of those key individuals who their actions were controversial at the time. Then we saw them appearing before the inquiry, and there was some press coverage of that at the time. Do you think that the inquiry has struck the right balance in what's come through in this report between identifying the strengths and weaknesses of individuals who were part of the decision making, who were part of the process, part of the political culture, as you say? Between that, you know, was it good for the UK to have Boris Johnson as Prime Minister during the pandemic, and identifying lessons which should be useful to all ministers from here on? So that have they gone far enough beyond, you know, the downsides and advantages of having those individuals we had at the time?
They have tried to do that. I think the challenge now is whether or not this government and future governments, future ministers are listening to that. Because yes, you know, the failings of Boris Johnson and Matt Hancock and Dominic Cummings are sort of well documented, and as Alex said, it's sort of, you know, poured over many times. And there are, you know, they do point to their strengths there as well. At the same time, you know, a government that doesn't necessarily have a clear sense of direction, with a Number 10 that is confused and briefing against itself and other ministers, you know, that we could be talking about 2025 as much as we could of 2020. So some of these things are potentially sort of ongoing challenges, regardless of the personalities and the politics involved. And I think it's really important for ministers to appreciate that and work out what they can do about that. But I also think there are some sort of bigger structural things in there. So and this is a shame where maybe the inquiry, or this report anyway, hasn't gone far enough in terms of its recommendations. So one of the things it talks about is COBRA, the emergency committee, wasn't the right model to run something like this long term. It doesn't really get into a lot of detail about what it thinks should be done differently. And actually that feels like an opportunity for you know, this set of ministers or future ministers facing something similar or preparing for something similar to think, okay, well, structurally, how are we going to change things? How are we going to ensure that we get the information in and that we get the decisions out in a way that is more strategic and structured than we saw in the pandemic?
Very interesting. Akash, as both your colleagues have already flagged up, really interesting the way the report looks into the effectiveness of how Westminster and the devolved administrations worked together during the pandemic. That's been an important theme in our work more generally over the years at IfG, but it isn't often something that gets publicly discussed, that question of what we call intergovernmental relations in the UK. What are the most important lessons from this inquiry for our understanding of how that worked in a crisis?
Yeah, I mean, I think it's absolutely impressive and welcome the extent to which this module in particular, the inquiry, really took seriously questions of how the crisis was not just, the pandemic was not just a UK-wide crisis, but it was really the first crisis of any, you know, anywhere near of this scale that cut across reserved and devolved powers in such a complex way, and to the extent that it was obvious very, very early on in 2020 that intergovernmental coordination was going to be crucial, because many of the key levers were held at the devolved level, the public health powers in particular, but control of other key public services and so on as well. But then, of course, key decisions were naturally going to be made for the whole UK by ministers at Westminster around economic support and furlough and all those kind of things. So intergovernmental working was really put to the test during coronavirus. I think we commented on it quite a lot at the time, and the inquiry really shines a light on that as well. And I think, what are the themes that come out? One is, again, a kind of maybe standard point that the IfG has made over many years. A lot of this does really come down to both personal relationships, but also too much still rests on discretionary decision making by UK ministers, and in particular UK prime ministers, because we don't have, certainly then, and things have changed a bit since then, actually, with the review of intergovernmental relations and so on. But back in 2020, 2021, we really didn't have a very well embedded, regularized system of intergovernmental working, interministerial meetings, and so on. And these things, to some extent, did then have to be created or experimented with on the fly, which worked to varying extents during the different phases of the pandemic. Because early on in the period, colleagues have already talked about, maybe there wasn't enough, people weren't taking this seriously enough in any of the four capitals, and that's quite a strong conclusion of the report. February 2020 was a lost month, I think. The inquiry concludes, and that's a critique, not just of Whitehall, but of the devolved governments as well. So there wasn't much coordination then. There was then a real ramping up of joint working between the governments in that early real crisis period in March, April of 2020. Devolved first ministers were then involved in COBRA meetings. When that was meeting, there was a creation of the ministerial implementation groups, which are a sort of new form of cabinet committee that was created to respond in a very kind of fast day-to-day way to the unfolding crisis, and that those bodies did involve devolved ministers as well as UK ministers, which I know the devolved governments found very useful. But then by, I think, June, July of 2020, UK government took the view that the real peak of the crisis had passed, and we were back on the path towards normalization. And a lot of that machinery was then swept away again. I mean, COBRA ceased to meet. Those ministerial implementation groups were just scrapped entirely. And that was a period then when the devolved governments behind the scenes, and that comes through in the inquiry report, Mark Drakeford in particular, were really making the case that we need to have a more formalized system. And those kind of pleas were, I think, falling on deaf ears a little bit in number 10. And then it changed again a bit in the autumn, when in particular Michael Gove took a real firm grip of coordinating between the governments. And then again, there were kind of weekly meetings between Gove rather than Boris Johnson and devolved leaders. So we really did see that fluctuate a bit. And as I say, I mean, it is welcome that since then we had the review of intergovernmental relations. Didn't change things dramatically, but it did, I think, take into account some of the learning from the COVID period, as well as Brexit, which had just preceded it, and obviously was also very challenging in terms of IGR.
And it was obviously a choice, Akash, wasn't it, for the inquiry to decide to look concurrently at decision making across the UK and the devolved administrations rather than consecutively. They could have done it consecutively. And when we look at the response, the analysis of the response in the report, it's very critical of the Northern Ireland executive, a bit more positive about Scotland. What are the main lessons that would you say that the devolved nation should take from each other?
Yeah, I think there's some really, really interesting and valuable stuff in there. And it isn't as simple as, well, the Scottish government was praised, you're right, is praised in the report for in autumn 2020, so the sort of second wave that led to then second lockdown, for being a bit faster to act, for having learnt the lessons from the spring. So yes, the Scottish government is singled out as having performed better than any of the other three governments. But on the other hand, in other aspects of how it was taking decisions, I mean, this has been discussed quite a bit, well, overnight and over many months, actually. Nicola Sturgeon's style of governance, like excluding many members of the cabinet, taking decisions in informal ways through WhatsApp groups and the like. I mean, that's all been pretty well discussed. So in that respect, the Scottish government was also criticised, whereas Mark Drakeford in that respect is praised for having operated in a much more inclusive way, genuine collective cabinet decision making. The report says kind of functioned pretty well throughout, enabling maybe better joined up government. There was also quite an inclusive approach taken in Wales to involvement of local government, and even opposition party leaders were involved, I think, in a way that we didn't see in other parts of the UK. So there are some interesting differences. Northern Ireland then, well, Northern Ireland's always a story unto itself, of course. And if you look back to 2020, I mean, we'd only just seen the restoration of power sharing, I think, a month or two before COVID hit. So it was all very fresh, even just having ministers at all. And the relationships maybe weren't very strong still, a bit fragile. And then Northern Ireland is just, constitutionally odd in how it operates as a government, reflecting obviously the long history that we all know. But you don't really have collective decision making or collective government in Northern Ireland at all, because of the nature of every department is very much an island unto itself. We criticize lack of joined up decision making in Whitehall, but it's, I think, much more difficult in Northern Ireland because of the constitutional structure. And the report of the inquiry is very, very clear that this led to, I think, poor governance, or at least certain frustrations in Northern Ireland, that you had the Department of Health there leading the response, led by an Ulster Unionist, Robin Swan, not the same party as either the First Minister or the Deputy First Minister. And then you had both the First Minister and Deputy First Minister giving evidence that they weren't kept updated in terms of decisions that were being taken by the Department of Health. They were finding out things through the media. There wasn't much, joining up with other bits of government. So yes, I think that does lead to one of the recommendations actually of the inquiry, that there should be a full review of the role of the First Minister and Deputy First Minister, of the Executive Committee, i.e. the Cabinet, as a whole in future crises, rather than it being led in this very kind of siloed way that we saw.
Very interesting. Stuart, you're our public services expert on the panel today. What was the report's verdict on how the government handled the care home sector during the pandemic, and what are the lessons there which we hope future governments will take away?
Yeah, it was pretty damning, I would say, about the approach to handling the care sector. I think they called the approach to how they discharged patients out of hospitals into care homes without testing devastating, I think was the word they used in the report. And they had an astounding fact, which is that a fifth of all COVID-related deaths between March 2020 and February 2022 happened in care homes. So it was an area I think the government neglected quite heavily in those early days. I think, maybe if I was being more generous, they chose to prioritize protecting hospitals over protecting people in care homes. I think there's some merit to that. Obviously, there was a feeling that there would be an inundation of people being admitted to hospital in the early days of the pandemic, and therefore they wanted to discharge people as quickly as possible to both to free up beds and also to protect those people from being infected with COVID. I think that the difficulty is that they did so without the testing into care homes, which then further spread the virus in that setting where there was far less infection control than there was in hospitals. Again, there was some merit to the reason they did that. They said that they didn't have the testing capacity available to test everyone. But I think also behind the scenes, there's an interesting dynamic that was going on in which the NHS had a relatively strong voice in the form of Simon Stevens, who was then chief executive of NHS England, and also Matt Hancock and the Department of Health and Social Care. But the care sector is mostly independent providers, roughly 18,000 across England. There's no unified voice for them. There's no sort of single person or organisation making the case in government. So I think in that situation, when you're trying to trade off between NHS England on one hand and the care home sector, it will always be NHS England that ends up coming out on top because they have a more unified voice, they have a stronger, more direct line into central government than the care home sector. So I think potentially for future governments, there's a lesson to be learned about how you bring in a more diverse range of voices into those kind of decisions, and also being aware in the moment. Because I think that potentially is the other problem, is they weren't even aware while they're making a decision of the lack of representation from the care home sector.
They didn't know what they weren't taking into account. I want to come back to that point you were making there, Stuart, about the role of DHSC and Matt Hancock in sort of taking a lead. But I just want to go first to our currently top-rated Slido question, which is about the way that the government talked during the pandemic about wanting to avoid the NHS being overwhelmed. And an anonymous questioner says, I can't find a clear statement in the report about whether the government actually achieved their overall objective of avoiding the NHS being overwhelmed. What does this mean? How should the government in future pandemics clarify this? So I guess the question is that a good objective? Is that a meaningful way to think about the NHS in the context of a pandemic?
It's a really interesting question. I think there's an element of, and that this was sort of something that came out throughout the way the government talked about the NHS, was treating it as an end in itself, almost, as in protecting the NHS being a goal that the government should achieve, rather than the NHS being a tool in its arsenal with which it should counter the pandemic. So I think that is a very valid point. In terms of whether it actually achieved that, I mean, it's very difficult to say because there's lots of different ways that you could measure this, and you're also looking at counterfactuals. I mean, it was effective at discharging people out of hospital into care homes. It was effective at freeing up beds in order to treat people. It didn't have the capacity to deal with an acute respiratory virus pandemic. There was a lack of ventilating equipment, for example, which I think meant that those beds were often almost always occupied. So in that respect, it was, I suppose, overwhelmed. I suppose it was, but there was a massive reduction in other activity at the same time. So there was far less elective care happening, far less cancer care. People did actually stay away from hospitals in terms of they attended A&E far less frequently, and also other bits of the NHS. They attended general practice far less frequently. So in that respect, they did manage to, I suppose, protect it, to prevent, to keep some capacity back to deal with delivering care for people who were in hospital with COVID. But I think, again, to come back to the messaging point, it was the report sort of reveals, or I suppose not reveals, but it highlights the fact that Lee Kane, who was then Director of Communications in Number 10, was the person who came up with the stay at home, protect the NHS, save lives slogan. Apparently, he did that in conjunction with a creative agency external to the government and without consulting NHS England. I think the NHS's view, so Simon Stevens' view on this, was that it might discourage people from coming forward for care that they needed for fear of overwhelming the NHS, so to speak. And NHS England then launched its own campaign to try and encourage people to come forward for care. So there was sort of competing messaging to the public. I think ultimately the government stay-at-home messaging won out, and they were more effective at communicating that. But that is an incoherent way to approach communicating what you want the public to do and also what you want the NHS to achieve. I mean, I think it's notable that central government seem more concerned about reducing demand on the NHS than the NHS did, if you take that reading to be true.
And as your work since, and I encourage everyone to look at Performance Tracker, which is our flagship public services report and just out recently, tells us a lot about how some of the problems which were stored up in public services from the pandemic. Akash, you look like you want to say something.
Yeah, just briefly, I just thought it would be worth pointing out to the person who asked the question, who said that the report doesn't answer the question of whether the approach to taken to the pandemic did save the NHS from being overwhelmed. Worth pointing out that this is just, as you said at the start, Hannah, the second in the 10 modules, the second of 10 reports. And the next one, I was just checking the list, is specifically on the impact of the pandemic on healthcare systems in the 4 nations of the UK. So that one, I'm sure, will get to grips with that very specific question. Maybe we'll do another webinar on that topic at the time. Stuart will no doubt be involved if we do.
I'm sure we will. Can I come back to you, Stuart, just on that question? And then I want to come to Alex on another angle on it. But how well was DHSC, would you say, set up for the pandemic? And was it right for them to try to take such a strong lead on the response?
Yeah, so again, the report highlights the fact that Matt Hancock, was then Secretary of State, was very, very keen to be the leader in this and to have his department leading the way. The indications from the report are that in many ways, particularly in the early days of the pandemic, the Department of Health and Social Care, DHSC, was quite overwhelmed by taking that role on. I think there's a few reasons for that. I mean, first of all, there was the historic split, well, I suppose now historic split between DHSC and NHS England. The NHS England is supposed to be doing the operational day-to-day running of the NHS. I should also clarify, in England, because this also looks at the devolved nations where there's different stories. And DHSC is supposed to be a sort of more slimmed down policy body that thinks strategically about what the NHS is doing, but doesn't actually take on the day-to-day running. And I think putting all that extra responsibility into DHSC potentially was too much. There's also other things that I think mean the pandemic was, well, DHSC was not well suited to respond to the pandemic. DHSC and NHS England both are very focused on the acute hospital sector. They always disproportionately focus policy, money, attention on that sector, think less about the wider health and care system. So I think that's another reason why care homes were neglected. But they are not well suited to think about what happens in schools, for example, or how local government operates in this situation. They are very focused on the NHS and within that acute hospital. So I think that is a risk. I think that also another thing that the report highlighted was that DHSC had to rely quite heavily on Public Health England, as it then was, which was a arm's length body that was tasked with public health provision and health security. But Patrick Vallance and other witnesses pointed out that Public Health England had been hollowed out quite a lot over the previous 10 years. It had a lot of its research capabilities pushed into the university sector, for example. So DHSC was both struggling with its own responsibilities and then also relying on other organisations within the wider sort of health ecosystem that were also badly equipped to respond to the pandemic.
Alex, so Stuart's given us some real insight there into the sort of what the report says about DHSC. What does it tell us about the relationship between DHSC and the centre and how that worked in terms of decision making?
Yeah, it's not particularly flattering about it. I suppose that there are at least 2 different angles to that. One is the specific relationship between, Matt Hancock and the number 10 and the Prime Minister and DHSC and the Cabinet Office and number 10, particularly in that early phase of the pandemic where Matt Hancock was, described as over-optimistic and too positive about the ability of DHSC to cope with the response, relying on the influenza plan rather than recognizing that it wasn't a plan that was tailored to a coronavirus. There's some criticism of the now Cabinet Secretary Chris Wormold for not sort of restraining Matt Hancock, but also not sorry, I'm being told my sound is coming out. I'll try and speak as clearly as I can. The current Cabinet Secretary Chris Wormold was not sort of restraining Matt Hancock, but also not sort of passing information back to the centre that DHSC was not as prepared as Matt Hancock was saying in cabinet meetings. So there's criticism there. There is, and I'm sure will be more in the next module, criticism about the sort of relationship between DHSC and NHS England, and duplication between meetings, or lack of coherence about how advice and how information was flowing through the health service and through DHSC. But then I think there's a second angle to it, which does also come out in the report, which is that the pandemic, Stuart hinted at it, the pandemic is a whole, needed a whole government response. And it was a mistake for DHSC to be put firmly in the lead for anything other than the health response. And it required that coordination in the centre. This was one of the failings. I mean, I think it's very bad form to quote yourself, but I'm quoted in the report. I noticed, I promise I didn't control F, I just saw it when I was reading it. I'm quoting the report talking about the consequence, which was a not unreasonable thing for Boris Johnson not to chair those early crisis response civil contingencies COBRA meetings, but Matt Hancock chaired it. But that sent a signal to the system that this is a health response, when actually the opportunity missed in that early phase was saying this is a whole government thing. We need now to think about the consequences for education, the transport system, the hospitality sectors. One of the points we've made, colleagues have made, is that one of the failures, and this comes out a bit in the report, of the response was in particular to look at the non-pharmaceutical interventions, lockdowns, and the healthcare questions as opposed to economic growth and the economy questions. The two were and are completely interlinked, because people were making their own decisions about whether they were going to go out and go to shops and restaurants and support the economy. There was a very siloed approach, and I think one of the big failures, and actually I would have liked to have seen a bit more about this in the report. It sounds crazy to ask for more than 800 pages on one module out of 10, but more of the report about where the government failed and how future governments can do better to synthesize those kind of questions at the centre. Things incrementally improved over time. The COVID task force was set up. That took a while to get going, but it was really only well into 2021, when the vaccine was rolling out, that the government seemed to have a coherent strategy and was able to grapple with some of these trade-offs. So to take over a year to get to that place was a government failure, and I think it's something that that this report and future reports should reflect on. And I hope my sound was okay.
Your sound was fine. And it's worth saying that on just that very precise question, the IfG has been doing some really interesting work with academics at Imperial about how you might develop models which combine epidemiological data with economic data in order to be useful to decision makers in future pandemics. Alex, I just want to put to you quite an overarching question, which has come in from Daniel Wincott, which you seem to be the right person to answer for us. He says, on an initial reading, the report seems to me to be pretty critical of the performance of the civil service. Where does the inquiry's analysis leave the traditional idea that Britain has a Rolls-Royce civil service?
Gosh, where do we start with that? Attend lots of IfG events, and you might be disabused of the illusion that the civil service is Rolls-Royce, because there's lots for it to learn. I think my overall impression, and we'll put out something on this later today, I think, is that this module of the inquiry didn't really grapple with the civil service as an institution. How it wasn't looking at, the civil service, capital C, capital S. And I found it actually quite hard to draw out lessons for the civil service as a whole, other than this point about, and we've touched on it, but kind of openness and receptiveness to challenge, and the way that decisions were being taken in very kind of closed loops. Where I think it is, it is more targeted at is certain individuals, but also the kind of structures and processes inside the civil service. It does talk a bit about the kind of the governance structures. It does talk about the siloed nature of government departments. It does talk about, and Tim will rightly say and has said, that the culture is set at the top. But civil servants have their part to play as well in the kind of the cultural problems that we saw in number 10, the Cabinet Office, and elsewhere. Clearly, individuals operating under huge stress, but civil servants are professionals, and sometimes part of the job of the civil service is to take the heat out of these situations. So yeah, I mean, lots for the civil service to learn about receptiveness to external challenge and the way it sets itself up, and the nature, I think also, maybe we would say there's lots of other IfG material on it, of the centre of government, and how the centre of government in a civil service sense is set up to respond to a crisis. Yeah, and I certainly think from over the course of 2020, we weren't enjoying the benefits of a Rolls-Royce civil service.
Tim, can I come back to you and flipping over to the political side? One of the key themes of the report is that the cabinet was sidelined. How much of an issue do you think that is to do with this having been a crisis situation? And I guess the particular characteristics of this crisis situation in terms of the need for social distancing and so on. And how much is this just how cabinet and political decision making at the centre works in normal times, that cabinet doesn't always have as much of a say as people might think?
I think it is mainly the latter. I mean, yes, as you say, obviously for a lot of this period, ministers couldn't actually get together. We saw the pictures of cabinets happening on Zoom with, Boris Johnson sitting at one end of the massive table and a screen at the other with 25 faces on it. So there was an aspect of that, but I do think, yeah, it's a bit of a misunderstanding potentially from the inquiry as to the role of cabinet, and whether that's a good thing or not is kind of to one side. But cabinet at UK level, and I think probably in Scotland as well, because it also makes the same point about the Scottish government, hasn't really been a decision-making forum for a long time. I mean, you talk about Tony Blair and Sofa government, Margaret Thatcher, sort of seen as almost, maybe the first presidential prime minister, but this is not a new thing. And there are different ways of making group decisions in government that do not involve getting 30 people around a big table, because obviously that's not a good decision-making forum. There are cabinet committees that bring together a smaller group of ministers to discuss a specific issue. There are different types of meetings. There are written processes, all different ways of doing it. And I think, again, but kind of linked to what Alex was just saying, this was perhaps one area where the inquiry sort of could have gone further, or sort of perhaps missed a little bit in thinking he wasn't convening cabinet properly, or he wasn't involving cabinet properly, and therefore that's bad, rather than thinking about, okay, but how were decisions actually made in government, and were those processes working well, and were those, was the right information being shared, were the right people in those conversations? I think that's potentially more, that would have been more insightful and more revealing, and I think that's a bit of a shame. And just to reiterate what I just said, but I do think it's interesting that they made the same criticism of Scotland. Obviously a smaller government in terms of number of people and number of ministers, and potentially therefore it's just something about politicians. A lot of politicians do like to make decisions in small rooms with trusted advisors, and it's up to the system to make that work rather than criticise that. No
longer smoke-filled rooms, though. Alex, do you want to come in?
Yeah, it was a really quick one, but just because it was building on something that Tim said, I have some sympathy for the inquiry of this, but I think it's been really hard for them to get to the heart of where decisions were actually made. And this isn't from this module, actually, this is from the first module, but I was very struck in the first module where the sort of cross-examination of it happened to be Chris Wormold again, of Chris Wormold about DHSC's pandemic preparedness and what the departmental board had discussed and the papers it had taken about pandemic preparedness and influenza preparedness. Now, anyone who knows anything about the civil service and government knows that departmental boards are absolutely not where those sorts of decisions are taken. There's sometimes an element of kind of, risk management or corporate discussions that happen there. but the important policy decisions about DHSC's preparedness and influenza being taken in meetings of the Secretary of State, in submissions and minutes to the Secretary of State. And I think the sense I slightly have from this inquiry is, and again, as someone who's tried to research decision-making during the pandemic, it's quite hard to get your arms around, to get a hold of those actual decisions, that meeting between the Prime Minister and the Chancellor, or that meeting that happened in the corridor. They try to get at them through WhatsApp, through WhatsApps and so on. But there's something about just slightly missing what was really going on and how those decisions were being taken. Now, there's clearly something in there about the propriety of decision making and record keeping and all of that. But I think I would have liked to have seen a bit more of what was the submission on this? What was the, where was the actual decision taken? And I think it's very hard for an inquiry like this to get under the skin of that sort of really important part of the decision.
Tim, I'm tempted to ask you about the whole WhatsApp decision-making point, because you've written a whole report for us about that. But instead, I'm going to go to a question from Charles Chadwick, who's which relates to something you think about a lot, which is how we bring people into government. He says, given that Prime Ministers are briefed on nuclear weapons as they start, might a briefing on what is needed in a crisis occurring also be beneficial? And how effective do you think that the induction into the role of the Prime Minister that we give these days is?
Great question. Yes, I mean, it's very difficult, right? So on the induction for PMs on crises, I remember we did, as part of this work we did on crisis management, we spoke to Jack Straw, and he said the first time that Tony Blair had been to the Cobra room was, I think, in 2000 or 2001. So 3 or 4 years into his premiership, he'd never even been down to the Cobra room, which I think is not the case now. I think every Prime Minister will have probably hopefully gets shown it early on in the first week. But, because the world is moving faster and we're in this kind of constant state of crisis, I'm sure they've all made use of Cobra much sooner than that. I think inducting prime ministers is probably very difficult for the system to do. The prime minister is the political head of the government. They will come in with their vision, their people. This is how I want things to run. And even, the most senior officials, the cabinet secretary, the principal private secretary in number 10, I don't think they would see it as their place to kind of say to prime minister, okay, this is how you do your job. I think the prime minister will want to say, I know how I'm going to do my job and I want the system to work around me. I think so. I don't think there would ever be a formal induction. I think what ministers can do is learn from predecessors, right? So we know ahead of the election last year that Keir Starmer was talking to Tony Blair and Gordon Brown. We know that at a lower levels of the ministerial ladder, there are lots of ministers who try and talk to their predecessors, whether in the same department and often across party as well, and hear what the challenges they were dealing with were and how they approached them. I think that's really important because we do a lot of work with ministers and with shadow ministers, and we are very keen to broaden that out. But at the end of the day, the best way to learn is to talk to people who have done it themselves. On crises specifically, I will say, as part of the work that you mentioned, Hannah, we have a workshop for ministers about how to do crisis leadership. And we also are working with the Cobra unit, the people in the Cabinet Office who run Cobra. And they do lots of good work with ministers on this stuff. So there is stuff out there on crisis leadership in particular.
So I've got a good question coming in, and I think I'm going to put it to Akash first, but there may be other people on the panel who want to have a go at it. This is our most popular question at the moment, which is simply how the government should be learning lessons on pandemic preparedness from other countries. The questioner is saying this was as an anonymous questioner, this was a massive hole in the inquiry's analysis. I guess I would say as a starting point, that isn't exactly what they set out to do. It's a really interesting and important question. And the closest they do get to it, as we've discussed already, Akash, is the comparative analysis between the nations of the UK. But do we think both in the analysis that the inquiry has done about what happened in the UK, but also when you look at how the inquiry did its job compared to inquiries in other countries, there are lessons we should be learning? Akash.
Thanks. Yeah, obviously, really interesting question there. I mean, I don't know and can't pretend to answer how other countries are undertaking similar processes of, inquiries or other mechanisms for learning from what happened during COVID. So I can't speak to that. I mean, I think, to be fair to the team running the inquiry, expecting them to do international review as well as the painstaking, wading through evidence from across the UK would possibly been tricky for them to do in any kind of systematic way. But yes, that did strike me as well, that there isn't almost any kind of commentary on how other countries did things differently. And I mean, the reality is, on some of the big decisions, like, is lockdowns ultimately necessary? The inquiry says clearly, we accept that they were necessary, and it's questions of timing and how the decisions were taken and communicated that they focus on. But not all countries followed exactly that model, did they? I mean, most did, maybe most European and Western countries did, but everyone knows about Sweden as a kind of partial exception that approached things in a different way. In some places, America notably, very federal structure. You had very different approaches taken between states, and I do personally think that in general, not just by the inquiry, I don't want to point the finger at them. As I say, they had a huge job to do, but in general, I think there's been too little consideration of, well, actually, those core questions. Did lockdowns work ultimately when you look at excess mortality over not just the kind of short-term period when the decisions were being taken, but over the longer term, and also, how did that calculation weigh up against economic impact on public finances and other public services and so on, that some of which the consequences we're still dealing with 5-6 years on, as we talked about a bit before. So I do think, probably not through the inquiry itself, but more generally, if we ever are to face a similar kind of circumstance, I would hope there is a bit more of a broader discussion about the wider set of considerations than just the specific control and spread of the virus as the only metric of whether a particular approach is successful or not.
Thanks, Akash. Alex?
Yeah, I think, again, quickly, really agree with Akash on that. One of the tests at the end of all of this, or hopefully before the end of all this, is, are we better placed to know whether, when, and how we should impose lockdowns? Should we be shutting schools or not? And one of my sort of niggling concerns is, are we really getting to the heart of those questions? So I completely agree with Akash on that. I think, to the point about, why didn't this inquiry do international comparisons? You could already see in an 800-page report how looking across London, Cardiff, Edinburgh, and Belfast was sort of diluting the depth that they could get into, and some of the criticisms you might make around the inquiry are because they already had that sort of enormous span. So I can completely see why they didn't go there, and I would assume, and I think actually this is a place where academic institutions, comparative studies, really could step in. Is a judge-led inquiry the best place to get into that kind of analysis? I think there's a more academic side to it. But I did just want to put in a note of kind of caution around really interesting really interesting international comparators, but places across the world were facing very different situations and had very different populations. So Australia was in a totally different situation to the UK or to Italy, or to clearly China, because they were able to react at different stages of the virus's progression. Sweden is very different to the UK because it has a less urban population and more dispersed centres of population. So I think we should be really interested in international comparisons, but we shouldn't fall in love with them, because we need to be kind of clear-sighted about our own situation.
Stuart.
Yeah, just thought I'd jump in. I completely agree with everything Akash and Alex have said. I think it would be a disaster if we didn't use this post-pandemic few years to try and gather as much evidence about the impact of lockdowns, both in the short term, longer term. I think that maybe the difficulty is, and sorry, it is also worth saying, there's some evidence to show that sort of long-term impacts on health systems have been, broadly similar across the world, despite different approaches to lockdowns throughout the pandemic. But I think also, and this is something that we talk about a lot in our work, is that evidence can only ever take you so far, and ultimately there will always be very difficult political decisions. And even if on balance, there is evidence that it harms mental health for children in the long term, in the immediate term, as a politician, you have to make those really hard decisions, balancing off other political priorities against what is the case, which I think actually speaks to the question that came up about should you just hand this all over to experts? And I think no, because there are ultimately always political decisions that have to be taken.
Yes, something that looks technical, actually, ultimately, when you're balancing the outcomes for different groups, the outcomes for how you spend money and so on. There's always got to be an element of political input. We have a grand total of 4 minutes left, so I'm going to go around the panel and you have 30 seconds each. What I'd like you to tell us is either the most interesting thing that you think has come out of this, the most important change that you think UK government should be making as a result. It might be one that they have already taken on, or one that you would like to see taken on, or the biggest gap that you think there was in this report, the thing that you would have liked to see but wasn't there. And Alex, I'm going to start with you.
It'll come to me first, give the others thinking time. I'm going to do 15 seconds on two. So the gap, because I've already talked about it, I think is that that sort of actually getting into the structures and processes of decision making in the centre. And I think more work is needed on what actually happened and how decisions were made and the structures that work. So Akash mentioned the ministerial implementation groups earlier. I don't actually think they work very well. I think other groups work better. That is slightly covered in the report, but I think zooming in on that will be really important for the civil service. Most important thing, and it's because we haven't talked about it, is what the report says about social inequalities and different characteristics and the differential consequences of the pandemic for obviously older people, but also disabled people, ethnic minorities, different groups. This is, it's very easy talking like this to forget how differently the pandemic impacted different parts of society. And I think the report actually draws that out quite well.
Great. Stuart, would you like to go next?
Sure, yeah. So I'm going to use it as a chance to get back on the hobby horse that I am now always using any platform I've got to bang on about. I would love to see some more work done on adult social care, both in terms of reforming it more substantively than this government is choosing to, but also I think a lot of the focus since the pandemic has been on that question of what's happened to the NHS, how well prepared was the NHS, how well prepared are we next time in the NHS for the next pandemic, which is obviously vitally important. But I would love to see some about what the adult social care sector can do, how the government can support it in order to be able to respond to crises more effectively.
Thank you, Stuart. Tim.
So I am going to also refer back to something I've already said or briefly, which is about this point of not taking a decision is still a decision. And I think if we can kind of embed that into political debate, political discussion, I think ministers are often, understandably, cautious. The civil service is inherently quite a cautious institution. And often the path of least resistance can be, well, let's wait and see. And actually, in these sort of circumstances, waiting and seeing still has outcomes. And if we are faced with a similar situation in the future, having that understanding, I think, will hopefully lead to better outcomes.
Thanks, Tim. You got 1 minute, Akash.
Okay, thank you. Well, yes, I think also, as we've talked about a bit, and I've talked about a bit, I think the modular structure of the inquiry naturally means that I think some of the really key considerations have been economic impact on public service. I think the economic one in particular, impact on children as well, actually, have been parked for future modules, which is fine and makes sense when you're carving up this huge job of trying to look at everything that happened. But I think it maybe has meant that this part of the inquiry has it hasn't produced that full rounded cost benefit analysis of some of the decisions, which is very difficult to do, of course. And hopefully by the time we get to the whole inquiry, we will have that full picture. But this is the real kind of high profile one, the one that the media's, I think, going to be most interested in, because it's focused on the Prime Minister, the First Ministers, their advisors, all that sexy media friendly stuff. And then maybe when we get on to the much smaller, it seems, actually evidence base that they're collecting on economic impact, it won't get quite the attention that it deserves.
Very good. Well, thank you so much to this panel for lots of really fascinating insight. You can look forward to more insight from the IfG about the COVID inquiry and public inquiries more generally. We have a comment piece out on our website already as we speak, which covers 5 things we think we've learned from this Module 2 report. That's on our website now, so go and have a read of that. We'll also be having a panel event on the 2nd of December at IfG with a different lineup, more experts from the IfG and some other people too, which will look we'll try to have some longer term reflections on what we can learn from this inquiry in terms of how we improve policy making specifically and how we reform inquiries themselves going forward. And we also have, because we're spoiling you, an upcoming IfG report on reforming public inquiries, focusing particularly that one on the early decisions that need to be made by politicians about how to set up inquiries, something we've touched on today. Are judge-led inquiries always the right thing to do, for example? And also looking at how the civil service can support public inquiries well. So lots more to come from us. For now, thank you everyone for joining us and have a lovely weekend.